groundwork we have already done is that when you go to a hospital, suppose you have 5-6 systems, computer systems, say, and they say Microsoft Linux or something like that, then person will be performing some exercise in front of that, and then whatever performance the person is making, right, that will be recorded. Analysis will be done. So doctor is not required to be there. That analysis will be happening and the doctor is sitting in the second room, say. And every patient is labeled. So I have, say, neck problem, someone is having shoulder problem, and everyone is doing individual exercises. They know what is to be done. Right? This analysis will help the doctor to identify whether when the hand was moving from this to this, where was the jerk, and they will identify the problem. So that is what is musculoskeletal disorder estimation and rehabilitation. One of the students is working on that now, though he has taken a little longer than we are expecting, because he started in 2016, now 2023 is going on. So cardiovascular disease detection we shall talk today. Fundus image analysis, ocular, non-ocular disease we have mentioned yesterday. We are also working on tuberculosis detection. It's not image processing, it is LFA, lateral flow SSA. Lateral flow SSA can be understood like what is used in case of pregnancy test. So there used to be urine drop, right, and then the control line and the test line, there will be color change. And this is easy in case of pregnancy tests. There are some other tests also where LFA is used. But for tuberculosis, the major problem is that the antigen is not very strong. And if antigen is not very strong, in that case what will happen? Only in case of HIV patients. So HIV patients suffering with tuberculosis, if you take urine or sputum or blood, right, you will find that LFA will give you clear indication whether the person is suffering from tuberculosis or not. But all tuberculosis patients are not HIV patients. Therefore, LFA cannot be used there. And the major problem that we have identified in case of tuberculosis is that the concentration of antigen is poor. So once you have identified problem, we need to have a mechanism by which concentration can be improved. Something which is unwanted in the urine sample, say, should be removed so that concentration improves. And therefore, when you put that drop in LFA, lateral flow SSA, like pregnancy test, then it should match with the antibody in such a way that color change happens, particularly if the person is suffering from tuberculosis. This is one of the very major problems. We are working on that. Uterine contraction, I have mentioned. Seizure detection per se is not very important problem. But seizure prediction is important. So what is seizure detection and prediction? Seizure detection will happen if you have EEG signal with you, and if signal analysis is being done, and if there is some abnormal signature available in the signal, that abnormal signature should be picked up to identify whether the person had some seizure or not. Say if the data is for say 24 hours, then you can do that analysis. But then that is not very useful in the sense that seizure has already happened. Person had already fallen down. Mirgi, some people. Seizure looks like that. Okay. So what we want is that we want to have a system where before person experiences seizure, he or she should get alert message. Right? What is the challenge? So if detection has worked well, prediction is not necessary that it will work equally well. Why? Because Once you have data, you can analyze, and you can take as much time as you want. But in prediction, you need to analyze data every window, maybe every 3 seconds data. You analyze and you just make a guess whether there was some signature which was giving an indication that person is likely to get seizure. Maybe if you can get that signature 2 seconds or 2.5 seconds, 3 seconds before seizure happens, person can stop because seizure will come and it will go. So person can sit down, right? Or person, if he or she is driving, right, he can stop it. Let that 5 minutes go, because within 5 minutes he will be or she will be all right and can move on. So we have worked on seizure detection so far. We have identified what are the signatures we are looking for, and now we want to see whether we can develop a computationally efficient algorithm that should work on a window which should pick up the signature which is likely to happen next. That is what is called prediction. So we are working on that problem. When I say we, I mean to say my students and I, and there are some collaborators from AIMS. This is what I mean by we. We had worked on low concentration oxygen concentrator. There is a reason behind that. Low concentration is very important word. Generally, oxygen concentrators, if you go in the market, they target for 99% oxygen concentration. Though the air that we inhale, it has only 18 to 20% of oxygen. Rest of the things are nitrogen. So people say that no, they want a very high flow rate, right? And higher oxygen concentration, 93, 94. In fact, higher concentration will limit the flow rate. So if you have low flow rate, if you can manage with low flow rate, then you can have higher concentration and vice versa. Now the question is that do you really need all the time 93, 94% concentration of oxygen? No. Think about the asthmatic patients. Asthmatic patients sometimes need some puff, not very high concentration. Sometimes you also might have seen that no, people do not go outside to cities, say for example, only because they are afraid that no, there can be severe need of oxygen concentrator, and that's why they avoid going. They used to stay home. So here we wanted to focus on low concentration oxygen concentrator which can meet that need. 20%, maybe 40%, double concentration than what you are getting, that will give some relief. And what is the other major problem with higher concentration? Is that the raw material that is needed is very costly for higher concentration. So for lower concentration, since material is available in abundance, right, is low cost and it meets several needs. That's why the focus was on low concentration. I'll discuss about this sleep quality assessment. If you remember, we were discussing about Fundus image quality assessment, right? Yesterday we were saying when you are acquiring an image, you want to send that image for diagnosis only if image is good. So there should be some algorithm which should make an assessment about the quality. Here we are talking about sleep quality assessment. What is the importance of this? Sleep quality assessment is needed because when you sleep, you do not know actually whether you really slept well or not. You know that in the morning, of course. And also what happens that when children are in the age group of say teenagers, I mean, they used to have a lot of anxiety, whether it is because of their admission requirement in any premier institute or for any other purpose. Some of you might be having kids, so of that age group. So what we wanted to do here is that we do not want to send that person in sleep lab. These are some of the major constraints why people avoid going to sleep lab for sleep quality assessment. So what we thought, we can have two mobiles, right? So at every home you will find, and in fact I have also seen people having two mobiles, one person, two mobiles. But at least you will be having, in family, every person has maybe 2 or 3 mobiles will be there in a house. So what we wanted to hide is that one mobile is a transmitter, other mobile is a receiver. You can put those things on two ends of the bed, right? And in the channel, that is what is called as channel state information. So as person moves, right, the channel state information is recorded. So the system is not as accurate as that of the sleep lab, but it solves major problem. If you see how many times, how many nights you can keep lying in the bed without moving, pretending as if you are sleeping but not sleeping. You cannot do many nights, right? So घूमना पड़ेगा इधर उधर, something like that will happen. So that activity, that such motions will be recorded. And the major advantage with this is that people cannot say that if you are using mobile, why don't you record it? Video recording. Because that is a privacy concern, right? So we are actually developing some system where only channel state information using two mobiles, right? We shall be having some assessment about the sleep quality. We will not discuss about the e-health record and registration. So, epileptic seizure detection, a comprehensive analysis of advanced sleep learning. I'll just give you some glimpse of this. There are multiple slides are there, few publications I have. What happens actually, what we have done here? Generally you have label data. I think you all are from computer science background, most of you. So you understand label data. You have label data. So we have label data, seizure data. And what people had been doing so far was that you take EEG signal, which is typically 32 channels. So you have a cap you are wearing, 32 channels are there, signal is coming. You do analysis of those signals, whether you do whatever machine learning, deep learning model you use, you do that. What we have done here is that we have used a transformer. Transformer, you might be knowing that it is used for image analysis where and what is significant here of image and EEG, the correlation is that 32 channels is a 1 row, 2nd row, 3rd row, 4th row, 32nd row, 32 lines, right? And each line is a long line because you have recorded it for very long duration. Say 500 samples per second. Suppose you have 500 samples per second, and if you have recorded for an hour, you can multiply it by 60 into 60. These many samples you have. 500 samples per second, right? So 1 hour will have 3600 seconds. 3600 seconds is this. These many samples you have. So you have a long length signal, 32 channels. And we divided that into patches. And we found what are the patches that are indicating seizure, right? So this patch, that patch, that patch, these patches are indicative of seizure. And we got efficiency or accuracy of detection improvement from 92% to 96%. 4% improvement is a huge improvement, right? So the bottleneck of whole discussion in this case is that use of transformer, which was never used earlier, it was used for natural language processing, has been used in this work, right, to find out that detection accuracy, which went from, as I said, from 92% to about 96%. Rest of the things are, you can refer to some of the papers, Anil, you may require probably for people to have discussion on that. So here is the publication. If you want to take image of it, you can take it, or it can also be obtained from the website. You want to take image of it, or should I move it? Yeah, we can. So there is one which got accepted only recently, so that is not there on the website. But the rest of the thing 1, 2, and 4 is there on the website. You can take it. Third one will not be available because it is in production, so it will take maybe 2-3 days.
Right now we are also moving towards explainable AI in healthcare.
Yeah, so explainable AI, madam, is though earlier what people were talking about is that you have a black box, you give some input, you get out. And we do, I mean, by and large, people do not know what is happening inside it because all training has been done, and all hidden thing which was not otherwise visible to normal people is actually seen by the machine. Now those parameters, when used on the actual signal, it will be done. So explanation AI has actually brought in a lot of science in it which was earlier missing.
Because healthcare is the only domain where XAI is getting used more and more.
Yeah, but one of the major problems I have experienced, good that you raised that issue, one of the major problems I have experienced is that even if you take chest X-ray for say tuberculosis analysis, people have also started working on finding out tuberculosis in a person from the chest X-ray, TAB. But the major difficulty is that, see, doctor themselves can find out whether tuberculosis is there, particularly if it is in advanced stage. But because of this explainable AI, people have also understood why it is happening. But the major problem that I have experienced is that I take chest X-ray from hospital A, I have trained everything, and when I am taking this model parameters, using it with some other hospital X-ray images, hota nahi hai. So this type of problem is there. So unless we actually create a database where heterogeneity, all possible heterogeneity is there, that means images from hospital A, B, C, D, all those things are there, and it can capture so that it becomes really robust, then you can do. But it's not so data paper, and maybe I have experienced it.
Cross data set evaluation.
That is the problem. Yes. Thank you for bringing the word.
Sir, one of the requests is why we have taken only like 32
32
years. 64 are available for the
Yeah.
45.
Very nice. So, yeah, good. So, what happens, I'll take one problem here. So, one of my PhD students is working on uterine contraction, I mentioned. So, uterine contraction by EMG is there in the hospital. Karte hain log. We started working on MMG, magnet wala. So, there are 148 channels. I am coming to that question. So what happened when we analyzed data from all 148 channels, we got some accuracy. The problem that we were solving was, we want to really make an assessment whether the labor pain, kind of pain that woman is experiencing, whether it is actually active labor or not. That is what we wanted to make a distinction. So that unnecessary hospital visits can be avoided. पता चला कि कुछ और problem है right? That's what we were doing. So what we thought is that when we are using all 148 channels, we got full information, right? And then we cannot get this accuracy better when we are using less number of channels, right? So पूरा है तो बेहतर मिलेगा. on the other hand, on the contrary, we reduce that number of channels from 148 to 14, and the accuracy improved from 35% to 79%. Why? That is the question. The question is that all channels were not contributing. There were some channels, they were negatively contributing. Section 2 cervical dilation, which I mentioned is not easy, relatively. Since the discussion has come here where, motivation behind that, well, let me talk. So, in uterine contraction, why we wanted to focus on uterine contraction? Reason being, in the country, in different parts of the country, say Kerala for example, the maternity mortality rate is very low. On the other hand, if you go on Assam, the maternity mortality rate is high related to pregnancy. The number is MMR death per 100,000 live birth is a matter of great concern. MMR. So since this number varies from state to state depending on the literacy. So in case of Kerala, as you understand that medical education, nurses, if you remember, they are very large. Therefore, they are quite alert to take decisions in case of complications related to pregnancy. On the other hand, in Assam, why I remember these numbers is because I have just submitted one project proposal. So in Assam, probably that part is missing, and that's why MMR is very high. In the last 5th year plan, it was targeted that we want to reduce it to probably 100 from existing 300, 350 MMRs. So given that and the input that we had received from the doctor that there are 3 important parameters, if we can pick up those 3 important parameters and analyze, possibly we can reduce it. That's why the target is that we want to have system HUAM, that is, it should be used at home. If person has to go to hospital, then purpose is defeated. You can improve accuracy, but accuracy will be improved only in those cases when person has gone to the hospital. We want to see that there should not be any positive case missed, right? No positive. That means that any time there is any alarm, right, that should be addressed. Now in case of electrical method of uterine contraction, this is already matured, and that's why we have migrated from electrical to magnetic, although there are some challenges. So in magnetic, number of channels that I could reduce was 14 from 148, but still it is not very good, because in electrical you need only 3 or 4 channels and the accuracy is already 96-97%. But the 96-97% accuracy that is obtained is based on analysis of only a few data, meaning thereby we need to have huge data, number 1. 2, we have to reduce this number of channels from 48 to something like 6-7 if we can improve the accuracy up to say 98-99% kind of thing. 99% is too demanding, but possibly we can go up to 98% or something like that. So that is what we are working on. HUAM, uterine contraction, I have already told you the result, how it has improved from 35% to 78% when we have reduced channel. Okay, reduction in channel because there were some channels which were contributing negatively. So Deep Shikha is one PhD student, she is working, so I have given her name here. Rest of the things are motivation, and these are physiology where these sensors are deployed. EHG is the one that I was referring to, which is being used in hospitals. And this is the magnetic setup, right? It's very costly right now. So, but we will work on it. 151 channel is written. I have forgotten that 148 I was mentioning. Now we shall be learning about cardiovascular health monitoring. So Sudhanshu Gohar is one PhD student is working on that. I'll just I don't know why this PDF conversion has caused some problem. Now see the problem actually. This is the ECG waveform. And ECG waveform have several things. PR interval, so P, Q, R, S, T, and these all things are there, right? So don't worry about that. These all things are different phenomena of the heart chambers and how electrical signal moves, right? And what causes what to happen, that will be understood. In fact, the ECG signal analysis is done based on this, and people used to make a guess if there is any abnormality based on this table. What is this table? It says that P wave duration is this. This is depolarization of left atrium and right atrium. Okay. To understand this heart health, it is important that we should understand a little about physiology of it. How chambers pump blood, where it comes from, what is the circuit in it. There are two types of circuit. One, like plumbers, right? Plumbing. Let me tell you, I mean on the lighter note, no, this is a formal class, so I cannot use lighter. I have been told that in transmission. So, let's see about some physiology of electrical. This is a system that we have developed. And so what is new in this, the system, the waveform that you are looking at? What we have done is, if you want to go for ECG, what do? You go to a hospital, doctor examines you, advises that ECG leke aa jaiye, will analyze and will let you know whether you have any problem or not. So what happens, you have to go from his chamber or her chamber as a doctor to another room for preparation, open your, those all things will happen, lay down, gel lagayenge, this lagayenge, wo sab karne ke baad, these all things will be done. Signal will be there, they will record it, you will take a paper, come to the doctor, he will say ki kya hai. That's how it happens. So the total time, if you see, if everything is alright, where there is no queue, then it takes about 10 minutes to 12 minutes from going from here, reaching there, lying down, gel, electrodes, signal, print out, come here. What we have done is that you have one pen, this type of pen, we have done this. And then you go to the doctor, doctor is sitting there, two leads he will put here and one pencil. He will move his pencil on 6 places called V1 to V6. So V1, 2, 3, 4, 5, 6. And all signals are recorded there itself. Analysis is done. So you need not to go from this place to that. Now the
when we have capturing the signal, that are just like energy. We are capturing like brain, heart, chest, and so. So we are just touch with that particular senses, body organ senses.
yes.
So during this, as you are predicting, some cloth is there. You know, they have to come. So that are the noises.
No. Sorry, I could not say it properly. So you have to open.
Okay.
Yeah, that part you have to do.
Yes.
Yeah. Sorry, I could not.
They did not capture the actual energy.
No. So yeah, you're right. So I did not say that. I thought that because when suppose you are a doctor, I am coming to you, it is very easy for me to open my buttons and then you can move there. Yeah. Certainly. In fact,
How these are quantified?
Quantified means what?
What is the numerical interpretation of these systems?
Right. So if you see here, this waveform, right? This is ECG waveform. Now the ECG waveform, when RR interval is large or ST elevation is there. So ST elevation as an example, where is ST elevation? You can see that. Here is T wave, here is T wave. Just a minute. Here is T, here is S. So when ST elevation is there, it reflects to necrosis. That means when tissues of the heart wall have already died, right? There will be ST elevation, and that ST elevation happens because of certain chemical that is released from those cells which have died, and those cells corresponding to the tissues of the heart wall. Giving one example, and we shall be learning formally in a few minutes various phenomena that happens at the time of either heart failure or heart attack. So heart failure is very common, but heart attack is not very common. Heart attack is when the person is, possibly it's no more. So what I am saying by that is that since waveform analysis of ECG signal is well studied, the only problem that we addressed was to have a system that can be used to acquire that signal quickly. Because if algorithm is there, what one can do is that one can copy that algorithm and put it once you get that signal, right? So we have not focused on signal analysis for the purpose that this analysis is already done. Why are you doing it? So you focus on what is not done, right? So here, that's why you might see, here you have seen a lot of things. Here in this case, which we have developed, right? We have not put any data because this is in fan. We still we are working on that. So we shall just copy that algorithm and put it there. So one of the major problems that we saw in case of this development was, still it is there. What happens when you acquire signal in parallel? 12 lead information from ECG is obtained from 10 lead machine. There are 10 leads. And all these signals are acquired parallelly. So the first question that might be coming to your mind is that, is there any loss of information when you are doing sequentially versus what is done parallelly?
That's my question.
Great. Thank you. Yeah.
When we are capturing the energy, electric energy through electroshock, they are capturing it at the same time. Otherwise, when I have put up here, then I have put up here. These 2 seconds are not. That will
Yes.
be time.
I will.
That are the intervals.
I will.
The waves, they are going downside, as he said. That may be changed.
I will let you know what happens. Actually, yeah.
Generally from V1 to V. Basically, we move from that particular.
Very nice that so we are on the same page. So actually from V1 to V6, there is no serious problem even if you have time delays. Because you are putting lead, say V1 here, you are acquiring say for 10 seconds, because 72 beats per minute in 10 seconds, you have enough number of cycles. 60 beats per minute means that in 10 seconds you have 6 cycles. Generally, in ECG, you require 6 or 7 cycles. So that means you have 10 seconds, 10 seconds. But then when you are moving your electrode from here to here, there is a time gap of say 1 or 2 seconds or 3 seconds, let's assume. Then the waveform will be not synchronized with respect to V1 to V6. Is not a matter of serious concern. So where is the matter of serious concern? That I am telling you. The matter of serious concern is when you are taking lead 1, lead 2, lead 3. And lead 1, lead 2, lead 3, here I think I have that. Just a minute. So, lead 1, lead 2, lead 3 leads to find out AVL, AVR and AVF information. And unless lead 1, lead 2, lead 3 is obtained simultaneously, you cannot find out AVL, AVR, AVF, which is, I was looking for that equation, that is not missing somewhere. So how to address that problem? Because you have not acquired lead 1, 2, 3 parallelly. So you cannot find out AVF, AVL, AVR. Therefore, for the sequential, you cannot get 12 lead information. What you get otherwise, although it is time taking, what we did, we have taken lead 1 plus lead 3 is equal to lead 2. This is known phenomenon. Now you need to require only 2 leads, lead 1 and lead 3, because lead 2 you can generate from lead 1 lead 2. Still, they are not parallel, they are sequential, so there is a time gap. So when you add them, you will not get what you could have got when you would have taken in parallel. You will not get that. So what we did, we acquired 7 or 8 cycles of lead 1. We required. And we acquired 200 cycles of lead 3. And we found what is the best match. Once that best match is obtained, then we shifted. Now we have got information lead 1, lead 3 as if this is obtained parallelly. Once that parallel is obtained, you can get lead 2 also. Now you have got lead 1, lead 2, lead 3 as if they are acquired parallelly. They are not acquired actually parallelly, as if because of this matching. You have done it. So once that is done, you can find out, now it's the easy job. You can find out ABF, ABL and ABF. So from these observations and a little trick that has applied, you can generate 12 lead information from a 3 lead machine sequentially, where you have saved a lot of time without requiring patient to go to another room. Could I answer? Can you ask?
I think you are developing. So there are the queries. Can you compare both?
Very nice.
What are the gaps in IT?
Very nice. Thank you for asking this. See, in this research work, there is a cardiologist forming. So what the testing phase is still pending. So what we are doing is that because it doesn't require much time. So what happens? Doctor is here, patient comes, he records it, and that patient goes to 12-bit machine also, right? He records it. Now this data, both the data we have, we shall be knowing what error we are making in doing this process subsequently. That is what you are saying, right?
Yeah.
We need to actually validate the two.
Sir, what you are doing in 3-lead machine, you are repeating it for V4 to V6 also.
V4, V6 all V.
So, 2 times you are doing the same thing.
No, sorry, I could not follow you. If you can ask your question once again.
You said that you are shifting that.
Yeah. So what I was doing for V1 to V6, that is on the chest. There is no problem whether you take it sequentially or parallelly. There is no information loss. The problem arises when you are taking lead 1, 2, 3 sequentially. If you are taking sequentially, since you need to have them parallelly, you have to find out a mechanism so that the loss of this shifting can be compensated.
Like what? You measured V3 200 cycles.
250 cycles actually. We have made it a little larger only to ensure that nothing is missed.
I am asking that you repeated the same process for V4 to V6 also.
V4, V6, V4, V6.
V4, V5, V6. Because 3-lead machine will act on 3 points now.
No sir, I said V1 to V6 means V1, V2, V3, V4, V5, V6. These all things are sequentially recorded.
Yeah.
Here, there is no concern whether you take it sequentially or parallelly. So you will get no additional information if you are taking them parallelly or sequentially. So there is no question of matching of lead V4, V5, V6. No question. Is not required. So since this is not required, we have not done it. What is required is that lead 1, 2, 3 should be in parallel. That is required. One of the ways to solve this problem is that we can have 3 instrumentation amplifiers. We can place them and we can increase the number of leads. Once we increase the number of leads, we can acquire lead 1, 2, 3 parallelly. That we can do. But since we want to have it simple, We have to manage with 3. So constraint is that I have 3 lead machine. This is constraint. Right? If you relax that constraint, आप कह दो कि भाई you can use 6 lead, I will be happy. It's not costly, but then there is no uniqueness. Then people will be saying that if you are doing it with 6 lead, just increase 4 more. You have 10 leads, you have parallel machine, you are equivalent to what happens in case of.
As long as they are not costly, for the pure gold they have required to their proof they capture.
Yeah, so we have also worked on that. So it is not that the electrodes that they are, because they improve conductivity when they put gel there. So is it really necessary to put gel to improve conductivity, or there can be some mechanism by which you can improve conductivity without gel? So we are also working on that. Yeah, we are working on that to find out. See, gel, when you go for ECG or say ultrasound, one of the major problem is a chip. So they give you some cotton coaching. That's what happens.
As I found 1 year in one of the hospitals, doing this practices of the brain.
Yeah.
Without till they are properly working.
Yeah.
Because every time the patient is that are the accidental patient or whatever, so we first remove the hair from brain sound.
Yeah.
After that we are applying.
Head. Yes.
Gel and other things. We are capturing. After that we go for the patient.
Particularly if you are going for echocardiography or things like that, possibly you need that because it's structure and those things you cannot miss. Particularly if you are talking about ejection ratio, how much blood is coming from the left ventricle.
How much they have transferred that particular, just like you they can move from the other body parts.
Yes.
So with that time, gel is very important. That's why I asked.
Gel, see what happens generally, if you are getting signal which is satisfactory, our focus actually we do not focus on something like gel. Generally we don't focus on that. Signal mil raha hai na, so let's continue. But here the objective is that can we avoid that, because only acquisition of signal is not important. How conveniently you have acquired is also important, right?
Without gel, as I found, suppose there are some layers are. Suppose that we have just put a layer P5 P5. P5 they will not transfer the actual energy, whatever the alpha values we have expected.
So see about the EEG case,
Yeah.
there is a different problem as compared to ECG. Not really, but there is what I want to say is that generally people have hair on their head, and on chest there can be some people hairy chest, non-hairy chest. But still, even if it is hairy chest, there also you will not find that much hair as you get on head. You don't get that. Meaning thereby, you can solve that problem for chest or abdomen, right? Normally in abdomen case, when you go for ultrasound, whether it is for pregnancy or otherwise, there you will find that rarely there is a hair on chest. Peet pe kahan hoga, right? So there you can address, but for this you have to remove hair. And once if you are doing this much, gel लगाने में क्या परेशानी है? So if you are going to अब बाल का अगर sacrifice कर रहे हैं, gel भी लगा लो. इतना बड़ा sacrifice हो रहा है. So that's why the two problems are distinct from that point of view. Thank you for asking questions. Very interesting. It's very interesting. So, I would like to, so whenever there is about 50 minutes or so, or whenever you want to take a break, please feel free to advise me so that we can take a break and we can meet.
Sir, 10 minutes.
10 minutes break? Yeah, sure. Heart has 4 chambers in it. Here is the right atrium, here is left atrium, this is right ventricle, and this is left ventricle. These are 4 chambers there. Now what might sometimes surprises you know that this side is called as left and this side of the heart is called as right. So it looks opposite, right? But it's not the case actually. When I see it, I see that way. But when you see the patient has his or her right part of the heart. When I say part, because it has two chambers on the right side, two chambers on the left side, right? That's why this is the notation followed there. So this part this is not very important. I'll also move here. This is aorta I was referring to. I will also discuss about this a little later. I'll start from here. So heart is a hollow muscular organ located in thoracic cavity. Thoracic cavity is here, chest cavity. And bottom chambers are called left ventricle, right ventricle. As I mentioned earlier, this is the right ventricle, here is the right ventricle, and this is right ventricle and left ventricle. Please note that color. Color is here bluish color, and on the right side, my right side, this is actually left side, this is reddish. So wherever you see blue, that is carrying deoxygenated blood. It is not oxygenated. And wherever you see red, it is oxygenated blood. Please understand that it is not that when you take blood from any part, say veins, you will find a blue color blood. No. The color of the blood is red only it is representation. That's all. And then left ventricle has thick muscular wall, myocardium, than that of the right ventricle. Reason why it is happening. Nature is so beautiful, it actually does everything with a purpose. There are something that we know, we call that scientifically, we give reasons why this and that. There are something that we ignore. Okay? So why left ventricle has a thick chamber or thick wall? Reason being that left ventricle pumps blood in the entire body. It has to do more work than the right ventricle. Right ventricle has to push blood only up to lungs. Right? Lungs is very close to the heart. But then left ventricle has to push blood, and how it goes, it can also be seen. So here you can see aorta here. This is aorta, and this aorta is connected here. This is wall, right? And when this left ventricle squeezes, right, it pushes blood. So this wall opens upside. It doesn't open downside in aorta. So this aorta goes here, and you can see white color arrows. So blood is going that direction. This aorta, which I had said I will discuss later, this is what I am talking about. So this is connected to heart, right? Blood comes in, right? And it goes to various branches. Superior and inferior. I used that term yesterday. Everything that goes up is referred to as superior. Something that goes down is inferior. Okay? Now, maybe I can start here. So now left ventricle is connected to what? Where is the left ventricle? I had mentioned this is the left ventricle. Left ventricle is connected to aorta, I mentioned. Here is aorta. Left ventricle is also connected to left atrium, right? and both these parts are connected through valves, and these valves open only in one direction. Okay, so this left atrium brings oxygenated blood from lungs in it. Atrium, this brings blood in, oxygenated. Then this blood comes here. This is the blood coming in. It comes from atrium to ventricle. Once it comes in, now it will squeeze in the next cycle. That PQRST waveform, someone asked that question. What is happening there? Yeah, you had asked. So all these things are happening because of these phenomena. Meaning thereby, if we understand it well, then we can correlate this phenomena with the electrical signal that we see. So from there we can see that if this is happening that way, that means probably the problem is with the left ventricle. No, it is probably with the wall. It is probably with the atrium or things like that. That's why it is always important for anyone who wants to do deep diving in any research area. It is important to understand physiology and anatomy of that particular organ. We cannot target all organs simultaneously. Possibly, we can target one to begin with, and thereafter we can move to next one. Alright. So this is what is written, that left right ventricle is connected to aorta, is connected to left atrium. Okay. Now if you can see here how nature has made, do you see some white color lines here? This line, white color lines, right? These are some cords, and these cords are connected to these valve. Here is valve. They are connected to it. So, and you see the shape. The shape is downside, right? So when blood is pushed up, right, it shuts down. It doesn't allow. So the shape of that valve is made in a way that blood can flow from top to bottom. But because it's, you can understand, right? This is like this. When it goes up, it pushes, shuts, right? That is how this structure is. And this loved up sound that we listen by stethoscope, doctors listen to it. They listen to this loved up sound for the opening and closing of the valve. In fact, they listen what is the problem in the valve, not the conduction of the chambers. They don't listen that. For whether chambers are squeezing properly or not, blood is flowing out or not, these two things are obtained from ECG and echocardiography, right? Not by stethoscope. However, stethoscope also gives enough information, because if you have adequate experience, then you can listen that how quickly valves are closing and shutting, like closing and opening. When closing and openings are understood, then one can also estimate how our chambers are squeezing. Okay? So this line, arteries carry oxygenated blood away from the heart, while veins carry deoxygenated blood towards the heart. There you can find here pulmonary veins. Veins are. So the first impression that we get, in fact yesterday also while we were talking, it was mentioned that arteries carry only oxygenated blood and veins carry deoxygenated blood. If this is true, then this should not be veins. If that line is true, then this should not be veins, it should be artery, because artery carries oxygenated blood as a oxygen, one, loosely speaking, you can connect. That is not the true definition. The true definition is that it should carry towards the heart or away from it. Something which is carrying towards the heart is artery. Something which is carrying something away from it is veins. Other than Sorry, thank you. So you can see that oxygenated blood is coming. So there are 4 chambers. So there are 4 channels, not chambers. 4 channels through which blood is coming in left artery. 4 paths are there. You see, the paths are these 2 tubes, one can see, and these 2 tubes here. These 4 tubes are bringing blood in the left artery from lungs. Now we can go to the next one. The right ventricle. So left ventricle is over. We are talking about the right ventricle. Where is right ventricle? Right ventricle is here. This is right ventricle. See the valve shape. Can you see the valve shape? This is one valve. And here you see this valve. How they are made. How nature has made them. So it amounts that blood will be, see, if the chamber is like, if the valve is like this, blood should come from the top to bottom. And if the valve is like this, then blood should go from the bottom to up. That is how it should happen, because valve will not permit blood to flow in opposite direction because of its shape or structure. Right? So this is how it is happening. And then you can see here inferior vena cava and superior vena cava. This superior and inferior is always used this way. Something which is coming below, inferior. Not really, but this is how the convention is followed. And something coming up or going up is superior. So that's why the term superior and inferior vena cavas. Right? And they are, so this is carrying deoxygenated blood here. Deoxygenated blood. Deoxygenated. So the blood was circulated in the body. Oxygen was carried by blood. It is given to different cells in the body, get deoxygenated, comes back to lungs. From there, it comes to left ventricle, of course, first aorta, atrium, and from atrium to ventricle, and then it pushes that. It goes to lungs again, gets cleaned up, and then comes back, and so on.
Sir, my curiosity is knowing what is the meaning of oxygenated and deoxygenated.
Right.
Oxygenated means oxygen is shoved up.
Yes,
by the cells.
yes. So actually lungs has, I'll come to that. So lungs has a filter, right? When we inhale, that oxygen what we are inhaling, that goes and gets mixed up with the blood that is there in the body. So mixing of that oxygen with the blood is called oxygenated blood. When it runs in the body, it releases that oxygen to cells, and therefore it becomes deoxygenated. Could I answer? I don't know if I answered your question.
First part is clear.
Oxygenated is clear, sir.
Yeah, deoxygenated.
Deoxygenation.
Deoxygenation is that if you have something and if it goes somewhere, then what you are left with is not having that.
The blood coming towards heart is without oxygen.
Yes. See, the heart will pump blood to the body, and deoxygenated blood also needs to be sent back to lungs. See, good that you asked that question. Lungs, heart is sending blood, and that is what is being circulated. Is that clear? Okay. Now there are some structures. Here is pericardium. Pericardium is the outer portion, this portion. Why we are coming here? See here, there is a problem, heart problem related to failure in the lungs. There is also heart problem. We'll come there. That's why we were talking about what will happen if lungs are not doing its job properly. Number one. And there are a few more terms that we shall discuss. One thing. Second thing, when we are talking about these valves and muscles, right? Actually the heart problem is because of the failure in the muscles of heart. Nowhere else, right? So to understand that, those two things, I am coming here. So pericardium means outer. Cardium means heart. So outer layer around the heart is referred to pericardium. It has sag made of folded fibrous connective tissues. Too many terms. You look here. Tough, folded, fibrous, connective. If you see, there are connective tissues, there are non-connective. Fibrous, non-fibrous. All those things are there. So this special type of thing that is there here is having this property for providing physical protection to the heart in addition to the ribs and vertebrae, right? So here, in the sternum, it stops heart from over-expanding. So when over-expanding will happen? When blood comes back to it, right? Then expansion will happen. So if there is some chamber which stops it, it will not allow it to expand further. We shall see shortly that when some problem occurs, how overexpansion happens shortly. I think I can leave that. So there are some terms like pericardium, endocardium, myocardium, and cardiac septum. So here I can endocardium is inside. So this is endocardium. Middle layer is myocardium. When tissues die, they lead to myocardium death of myocardium cells. And then the last one is this one. Cardiac septum is this. Cardiac septum is that there are two chambers below lower chamber, right and left chambers. So separating wall is called as septum. Separating wall. Okay. Now blood pressure is written here. BP. So let's talk about that. So pulmonary arteries. Where is pulmonary artery? Pulmonary arteries means blood carrying towards the heart, right? We were talking about from the lungs, because blood will come from the lungs and also in the lungs. From the lungs, when it is coming, it is oxygenated. When it is going to the lungs, it is deoxygenated, right? So that is what pulmonary artery has blood pressure of 20:12. What is 20:12? What is these two numbers? So 20:12 means that when blood is pumped, you can understand. When the right ventricle pushes blood, it goes like this. Here. These two sides, blood goes. So when it is pushing, blood pressure will rise. Right? That is what is 20. When it relaxes, its blood pressure will not become 0. It is something 2010 or what I read, 2012. This is the blood pressure that we talked generally. 120, 80. What is that? So when the left ventricle pushes blood, it goes to aorta. Technically speaking, they say that this blood pressure is the blood pressure in the aorta. But have you ever seen people measuring blood pressure at aorta? Do they open it and then put sensor there to measure? It's not like that, right? And that's why, if you remember, there were a few slides I missed in the beginning. I will just scroll there and will let you know. So when blood is pushed, right, the arteries will get expanded, blood pressure will rise, called as systolic blood pressure, which is 120 mmHg of Hg. When it relaxes, means that when it has fully squeezed, then it will relax. When it is relaxed, then the blood pressure is 80 mm of Hg. We can talk more on that, but just let me tell you what people do. When blood pressure, you can see that. I mean, only, see, we shall not do in all terms. Only a few things you can understand. That this line, if you see, and this line, they are connected. They are connected through aorta. This branch is coming, and this cuff is put here. So actually, blood pressure is measured here, right? And it is estimated or calibrated that if the blood pressure shown here is something, suppose 110 is to 70, possibly here at the source blood pressure is a little higher. So this calibration, when it is done, then it is called an estimation of the blood pressure of aorta from the cuff wrapped here.
It means they are present.
Not necessarily. I will again emphasize this point that it is not necessary. If you are going away, it also should be understood where are you going to. If you are going to a thinner region, then the thinner region may show higher blood pressure for the same amount of blood. Isn't it? This is possible. So it is not a fair statement possibly that when you are going away, blood pressure will certainly fall. No. That may be higher also. So maybe that their experience, doctor's experience has suggested that rather than doing this, if you are measuring it, it might be almost the same thing that you are getting at aorta.
So you explained in your discussion that it is the estimation or calibration.
Yeah, I use that word. So it is estimated that, so whatever
Person is lifting some, weighted
Yeah, yeah.
from right hand.
Yeah.
Or from hand.
Yeah.
And
So
blood pressure increase.
yeah, I will come to that. So what happens actually, very nice. So what happens, when does blood pressure go up? Only two situations are there. My arteries are here, right? You have put some cuff here, and then you are measuring it. Unless the amount of blood that is flowing through those arteries or veins, unless that goes up, my lifting or not lifting will not matter. However, if we are doing physical exercise, what happens? When we do physical exercise, then amount of blood demanded by muscles is more. Where will that come from? Heart knows that. You need more blood. It pumps it. So when blood is pumped more, then in the same tube, if more amount of blood is coming, it means blood pressure goes up. If you have ever gone through treadmill test, right? In treadmill test, when you walk and then people observe your blood pressure goes up because the amount of blood being pumped by heart is higher.
I am interested to know the accuracy of measuring process. So if I am doing some activity only by the half part of the body, left body, and not by the right part of the body,
Correct.
then it will
So
be the
no, so let me answer that part. So heart does not make a distinction. That possibly, because what happens, as you can see, if exertion is here in one of the hands, it's the left hand, right? So blood will go. Now it may so happen that possibly because there is a more requirement here, hopefully there will be more blood here, and hence this I don't know is clear answer whether blood will really be equally distributed. Possibly no,
Yes.
because if there is more demand to some organ, there will be more blood to that organ. So hopefully blood pressure will rise here.
Blood is reaching to the left part and I am measuring at the right part.
Huh. So
Both are
yeah, so that, but see the point is, for academic interest, one can have arguments and discussions. But for actual problem, when person is going for really blood pressure measurement, right? Typically what happens, we go when we have some symptoms or otherwise also. No, we want to be really safe, and every morning after walk I want to get my blood pressure measured, and even doctors advise keep a badge also with it. So that is what, because they want to ensure that what is the resting blood pressure,
Yeah.
right? Of course, when we are doing exercise, it is also possible. So my answer to your question is that for academic purpose, we can have discussions on that and understand details of what will happen by measuring blood pressure on the right and the left hand. When work is being done by right hand, what is happening on the left hand, and so on. So those can be of matter of academic discussion. I don't know precise answer to that question. My first impression is that if I am doing some work here, then hopefully blood pressure will rise here. From common sense, I am saying.
But I got answer, sir, you told that we measure the resting blood pressure.
Resting blood pressure is what we generally measure.
Body organs require the same pattern of it. That's why we are. Sometimes blood is not pumping. You are suggesting push up.
Yeah. So there will be a few more interesting things possibly I will cover. It's very interesting. So well,
DA's question.
If person is facing a problem of paralysis, means right
paralysis.
paralysis,
Yeah.
or right, in that case what will happen?
Yeah. So what happens is very nice. So what is paralysis? First we need to understand that. Yeah.
Okay.
So blood has not gone to the brain, and maybe that depending on which part is having higher cranial pressure rise, right? Other part of the body will be affected, right? Meaning thereby, if there is any blockage in the arteries which are carrying blood to brain, whether that if blockage is there, less blood will go there, right? Then that leads to what is called as paralysis, because some of the neurons of the brain will get dead, and then the rest of the thing will happen. I think that the organ which is inactive because of paralysis, hopefully blood pressure there might be low. But I don't have precise answer to that question either. I don't know. So these are explanations that I am giving here is based on common sense. Okay?
But,
Now,
I get
clinicians can certainly answer that question. I being like you engineer only, so
Yeah.
something I have learned, so I am just talking about common sense. Yes. And Dr. Anil, you want to say
Yeah.
something?
Actually, for these questions, as he have asked, some body organs they are not working. Means such of the 40 is there. This blood is moving in veins and arteries, but that
Yes.
blood is not creating the energy, just like this. So that's why means blood, that body organs, left or right brains, they are not giving the commands. Like
Actually,
my
it is
hand
the
is
problem
not
of-
moving.
It
It
is
is
a
not giving the
neuron.
commands.
Actually, it is the problem neuron.
Correct.
But heart pressure, blood pressure is also reflected in that case.
Yeah,
Yeah,
so
heart is also because
possibly there might be minor changes in that. So what is happening is that brain is not giving adequate signal for hands to move. Say if my hand is paralyzed or my leg is paralyzed or left part is paralyzed. But most probably because heart is working properly and the channel through which blood is flowing, that is arteries and veins, if that is proper, in that case possibly blood pressure will not be affected. Possibly. Only thing is that the parasympathetic and these signals are not reaching, and that's why action is not there. So this is again Clinicians will be the right people to answer those questions, but my first impression is possibly that blood vessels are intact, heart is working fine, blood will go, it will expand and relax. When it is expanding, blood pressure will go up. When it is relaxing, it will be down. Given that, hopefully blood pressure will remain, but then if it is very inactive, possibly is very smart system. If some organ is very inactive, possibly blood will also be low. If you don't require, why should I give you? That he knows. So
50% as the scientific.
possibly. So any number will be beyond my scope.
And everything is monitoring by the spinal cord. There is a liquid, so they are monitoring all body lower parts of the abdomen.
Yeah.
Which is active, they can supply whatever the ratio of the abdomen, either push up or push down. They are just coordinating activities. That's why people when something from the paralysis side. That is not normal.
Sir, may I ask one more question?
Please.
Sir, like nowadays we are listening in the news that many of the youngsters are losing their life while gymming. So is it heart failure or heart attack at that point of time?
Heart failure actually means that when chambers are not working properly is called failure. Is not attack. When heart stops working is attack.
That is
So failure, as I was about to discuss about that term shortly. Only see if my lungs are not working. You can hold on maybe
Yes.
your question. Maybe I'll just come there.
Sure, sir.
Yeah, but then one thing is that failure, heart failure means that when chambers are not working properly, have not stopped working, they are not working properly, then it is a heart failure. So these are some numbers. Only thing that might be of interest for us is that 5 liters per minute is the amount of blood being pumped by heart, right? And there is some calculation that I want to skip because of other important things are there. Now, you see here, pulmonary heart disease. Here is pulmonary term related to lungs, and heart disease related to heart, right? And that's why we were talking about how blood flows from lungs to heart and vice versa, from heart to lungs and from lungs to heart. So what happens? So let's see here. Heart disease caused by problems in lungs are referred to pulmonary heart disease. And what are they? There are 2 forms of pulmonary heart disease due to pulmonary hypertension. Pulmonary hypertension, the term I have used, if you remember previous slide where I had used 20/12, right? That hypertension is what is being referred to. And why it happens, you see here. So pulmonary hypertension can be acute, such as venothromboembolism. It's very tough to remember. So I learned many times to remember how to speak it. VTE. And so there are meaning of each one of them. In this case, blood clotted in the deep veins. So deep veins is term. So this means that there are veins which are not deep, right? So blood clotted in deep veins called deep vein thrombosis, DWT. This clot in circulation gets lost. So if in veins some clotting has happened, that clotting will move in the system, in the body, and if that gets lost in the lungs, right, that is what is being, this clot in circulation gets lost in lungs, right? This is known as pulmonary embolism, PE. So 2 things, DVT and PE together is called as VT, right? And what happens when there is a blockage anywhere in any circulatory system? I am saying in any circulatory system, ultimately the effect will be on heart. The resistance of that path has gone up because there is a blockage, and heart is pumping. Now who is pumping what? Now in this case, right ventricle will get affected. Look here. Why right ventricle? Something is lost in the lungs, right? Blood is being pumped by right ventricle in the lungs, right? Because left ventricle pumps blood in the system and right ventricle pumps blood in the lungs. Now if there is any clot in the lungs, resistance has gone up. Now the amount of work that right ventricle has to do now has gone up. There will be expansion of heart, right? That is what is called as right ventricle failure.
Sir, what I am thinking now that heart knows that 5 liters per minute has circulation and the body size is fixed, so the reversal of blood is fixed also.
Yes.
So those persons who lost their particular limb, like particular part of hand or part of leg, then the blood will not circulate that much.
Not like that. See, if suppose someone has lost his leg, right? Blood is being pumped. If you see the function of blood pressure and the amount of blood, it will become clear. See what is happening. This 5 liters of per minute has come with a lot of calculations. It has come with what is the stroke volume. So how much blood is being pumped by the heart chamber? What is its ejection ratio? That means how much blood has come into it from the lungs via the left atrium, right? And then it pushes back. Generally, when you see a sick more blood, then rest of the thing will also get adjusted. In that case, 5 liters per minute is not sacrosanct. Is not sacrosanct. Possibly, blood pressure is sacrosanct. If blood pressure is sacrosanct, then the amount of blood being pumped by the by the heart will get reduced. This is not sacrosanct. Is that fine? So these are calculations are there. Because I want to cover something a little more important possibly, I thought not to discuss these things in details. So thank you for asking that question. Now, so one problem we talk about venothromboembolism, right? Where there is a clot in the lungs. Now there can be other problems in the lungs. So this is all in the class of pulmonary heart disease. Here also it is pulmonary heart disease. Here also, no, only 2 places, yes. I thought I have more slides on that. There can be chronic problem in heart, lungs can also lead to heart problem. What is that? Such as chronic obstructive pulmonary disease, COPD. You might have heard this name if you have someone very senior in family and having some, breathing problem. You go with the PA view of chest, doctor will identify whether it has become flat or it has that shape. If it has become flat, the person is most likely suffering from what is called a COPD, right? So lungs are not squeezing or opening that properly. So here is typically caused by chronic bronchitis. In this case, enough oxygen do not get into lungs. So there is a term, I think somewhere I have written, I have forgotten. Right? So there is a filter actually outside of the lungs, right? And this oxygen gets filtered, and that filtering is essentially permitting oxygen to go in, rest of the things are rejected. So when enough oxygen is not getting mixed in blood, right? If you go SpO2, that measurement, you find oxygen saturation to be low. One way to improve your oxygen saturation is take deep breath. You can try doing it. Maybe in some day you be in generally in room and come just see blood pressure, SpO2 measurement. You may find 92, 93%, something like that. Take a few deep breaths. You will see that it shoots up. It happens. In fact, that those who are suffering with chronic disease, COPD, this was the reason why in COVID time people were saying that those who are having lungs problem, they should be extra careful because oxygen to basic filtering nahi ho rahi. You are only getting 20% of oxygenated air. वो भी filtering नहीं हो रही है. Your oxygen saturation level is already low, 92-93%. They are safe because उनकी body accustomed है. So only way to save is that. So what I'm saying is that there can be another reason why a person can suffer from ill, or people can have both the problems, VTE and also COPD. So maybe I can take 5 more minutes, if you allow. Yeah. So your questions are encouraging me to talk more. But hypertension, I can leave that. Hypertension, I want to discuss about this. Maybe in 5 minutes. So in hypertension, what happens here also? Atheroma, a sticky substance, is developed in the blood vessels, leading to disease called atherosclerosis. So atherosclerosis, because if something is like what I was talking about clotting, the similar thing, sticky material, if it is there in the blood vessels, that is what is leading to atherosclerosis. So workload on the left ventricle, what is happening if those, so we were talking about the right ventricle so far. If the problem is in the lungs, then chances of right ventricle failure is high. Because communication between heart and lungs, right, when it is pumping blood, is by the right ventricle. If atherosclerosis is there in the system, right, blood is being pumped by left ventricle, so left ventricle failure is possible, right? That is what is being discussed here. In details, these things are there. Just a minute. Why it ran away? Possibly it doesn't want me to continue further. Okay. How much time I have? Feel absolutely free to advise me. 5 minutes will be fine?
Yes, sir.
Just 5 minutes, okay. So what happens, why this, why atheroma or why atherosclerosis happens? What happens actually if I have LDLs are high, low density lipoprotein, because I am eating a lot of fatty materials. My liver is producing LDLs. LDLs will circulate, and blood vessel has 3 layers: tunica, media, intima, and extrema. So media is important, middle layer. They have used this Greek and Latin word. I am not using. I am actually reading them, that's all. I don't like that. So they have 3 layers, right? The first layer, the inner layer, is very smooth. It allows blood to flow, without any turbulence. But if LDL is high because of fatty food that we eat, right, there used to be less nitric oxide generation, and if nitric oxide is low, then the inner layer, this my tube, this becomes sticky. Okay, when it's sticky, then LDL will come, and it goes in the middle layer. Now WBCs see that this is foreign, they will rush. They also go in and eat them. This is their job. WBC's job is to actually, these foreign materials should be engulfed. They eat it, mote ho jate. After that, they die. When they die, they swell. So the middle layer of the tube, this is tube, middle layer swells. When it is swelling, you can see the clotting, right? The bulge, there will be bulge. But still, they are not coming in contact with blood. Good part. It's a good part. They are not coming in contact with blood, although blood flow is not that smooth because bulging has happened. Now the problem.
Thank you so much, sir, for sharing with us so many future aspects in healthcare domain, and also letting us know so many interesting facts about the God's very beautiful creation that is human heart. We got more curious to know more and more about heart in today's discussion, and we would like to hear you again in our near future events again. On behalf of ABS Engineering College, I thank Dr. Anil Kumar Tiwari sir for providing his gracious presence to join us today to enhance our knowledge. Now, I would like to request Abhishek Shukla sir to kindly present our mentor as a token of gratitude to our guest, Professor Dr. Anil Kumar Tiwari sir.